When we had David Clark in, we as the Minister of Health, we asked him, I said to him, can you please explain to our American friends why we are able to have, like when I go to the chemist, I don't pay any more than $5 for a prescription. I saw Bernie's trip to Canada the other day. In Canada, they pay $36 for a vial of insulin. In America, they pay $340. In New Zealand, you don't pay any more than $5 at the chemist for everything. Can you explain from your perspective to our American friends, why are we able to have the healthcare system? My mum passed away last year, motor neuron disease. She had a bed from Germany flown in for her and given to her. She had an electric wheelchair, given to her. Obviously, that were all returned once she passed, but she didn't pay literally for a thing and got world-class top service, everything all the way through. And my parents have health insurance, but they still got all that for nothing. So can you explain to our American friends why we're able to provide healthcare to all our people and where many over there think you can't?
In short, because we consider it a core public service, and we consider it a public service that is also going to help us keep communities strong and spend money wisely for all of our other services. Also, I was thinking about my son, who is now 11, 2.5 years ago, picked up some weird virus that actually had all of the South Pacific and Australia experts and doctors. It was like an episode of House, scratching their heads because they couldn't figure out what the massive drop in his eosinophil blood count was, a drop that they had barely seen before. And he was put through heart, organs, brain, blood, numerous expert tests over months and months and months and months. We are a privileged income household, obviously. We went through the public health system, and that all of that was done on the investment in our public health system. It's fantastic that we have been able to approach health as a core public service, a collective service in the interests of all of us being stronger.
I also think that maybe the Dems, Bernie and Elizabeth Warren, have it wrong at the moment because they are talking about getting rid of all private healthcare insurance. Whereas what I want to know from them now, maybe you can hook me up with the squad, is actually we have a very good, albeit it's not perfect, but a very good public health service, but also people can have private insurance if they want to. I've got private health insurance, but if I fell down the stairs as I was leaving here and broke my ankle, I'd go to the public hospital. So I think one of the things they seem to be missing, it's an all or nothing. And I want to know why the system that we've got, or perhaps Canada's got, or UK's got with the NHS, that seems to be a logical system where there is a free option that everyone has access to, or for those who have means to it, if you want to go and get private to cover a few things like, I think I'm specialists in operations or something, they can do that as well.
I think it's a different, what we're seeing there is their all or nothing approach is a slight different context. So if America had been on a good trajectory of good public health care, then maybe they'd be in a position to not have to uphold the choice of some private health care. Because we have such a strong public health system, some of the time and for most people, most of the time and for most people, we can legitimately entertain private healthcare insurance because it's not at the cost of a public healthcare system. So I think that's the main difference. I do want to put a caveat in there and say that there are some inequities that still are coming through, but for different groups. So, for example, cancer is a big deal. Simon is right in that respect. Cancer. The sad thing. Let me just go to the side for 2 seconds. The sad thing is that they absolutely pulled back health funding while they were in 9 years of their government, and they wound down the Cancer Advisory Group 4 years ago. So let me just put that there. However, he's right. At the moment, you have crowdfunding and give a little pages for some cancer sufferers to get their medication, and for people who can afford it, there's a straight inequity there. So there's still some things to mop up. There's still some equity things to mop up. But in the large, we can have private insurance because it doesn't undermine our public health system.